Today we're going to talk about how does diabetes affect the eyes. Yeah, there are a number of things that occur that result in eye problems for those that have diabetes unchecked. Number one, we see diabetic retinopathy. We see there's glaucoma. We see there could be cataract. We could see there could be macular edema, and there could be blurring of vision, with the ultimate complication being blindness. How does diabetes cause these problems? Because there's high sugar in the blood, these parts of the eye draw fluid into the eye. So there's tissue swelling. Because of the shape of the eye that is affected, there'll be blurred vision. There will be swelling of the tissue. Even the fluid will be increased. You know, the eye has fluid in it. So the fluid will be increased. There'll be increased eye pressure. This alone can cause problems with the vision. When we say diabetic retinopathy, we're seeing the retina, the innermost part of the eye, they can be affected. How is it affected? There's swelling, there's damage of tissues. We've explained what could cause tissue damage before: fat deposits, breakage of proteins. What the body now does is to develop new blood vessels. Unfortunately, these new blood vessels are weak because the raw materials that I explained before are not readily available, and they can easily burst and leak into the inner eye and the middle eye. This can cause problems with the retina. There'll be blood hemorrhage that is bleeding into the retina. There will be a lot of dark spots. This can also contribute to blindness and increased intraocular pressure of the eye. But the macular edema, the part of the eye that we use for driving, reading, seeing, identifying people, is the macula, is the most sensitive part of the retina. This part accumulates a lot of fluid drawn from the sugar content, and it swells up. It can detach from the other layers. It can completely remove. This swelling is what we call edema, and because of that, there will be difficulty in seeing. There could even be blindness. In the case of glaucoma, glaucoma here will be resulting from number one, increase in the pressure in the eye because of the fluid. Number two, this pressure is so much that it starts damaging the optic nerve, the nerve that takes your signal from the eye to the brain to interpret. And what you see is that people have things like, we call them tunnel vision. That is, it looks like you're looking through a pipe. So only one narrow part, there'll be dark areas around your field of vision. And for cataract, cataract occurs in people in advancing age, but it gets worse and it's more seen in people that have diabetes uncontrolled. I have video on cataracts. I hope you watch that and you get understanding. These are diabetic eye diseases, or how diabetes affect the eyes. Thank you for watching. I'll see you on the next one. Bye bye.